Continue to share, continue to react. It is about supporting and being present for each other. And so, again, invite you in the chat to continue in all of this. What we'll go ahead and do now, you have met them. Some of you have met them, but I would love to just take a moment to also share with you a little bit about who will be leading us through today's journey. Nicole Valenzuela is a licensed social worker, deeply committed to the community-centered care, emphasizing upstream prevention and advocacy to create lasting positive impact. Her work transcends substance use prevention. She's adopted a holistic approach to foster well-being across diverse communities. She applies data-driven strategies to ensure that her work is inclusive, equitable, and resilient for the individuals that she serves. Central to Nicole's work is building strong, trusting relationships with community members, partners, and stakeholders. We welcome her and her expertise. It spans program planning, program evaluation, needs assessment, multi-sector collaboration, and she's just a wonderful human that I'm happy to know and have us join today. Our second facilitator, Jennifer Khalifa, is a Senior Director of Prevention and Capacity Building at the California Partnership to End Domestic Violence. She has 15 years of experience in domestic violence prevention, public health, and organizational leadership. She is and leads statewide strategies. She is in it and training and advocating, providing technical assistance on initiatives that strengthen the capacity of organizations. And she works to advance health equity and to end gender-based violence. Another wonderful human that I'm happy to know and to have in this space. And we know that she will talk to and really model that. The systems change, inclusivity, youth leadership, and community-driven solutions that she brings to her work. So thank you all for being here. And with that, I will pass it forward to Nicole and Jennifer. And again, thank you all for being here. And thank you for sharing in the chat.
Thank you, Tina. I really appreciate you. It's just very kind. And I just want to take an extra moment to just honor and hold this space with you all as well, that we are showing up as we are, and just as it's okay that if our lives don't look like they normally do, that we think that we're supposed to function a certain way, and there is no normal right now, and to give yourself grace, to give yourself time, to lean in on your support system. We're all here for each other. I know our contact information, or you can get a hold of us through Tina, but we too are community. And just how are you? And it's okay if we are angry. And like, I love what Jennifer, excuse me, had shared, that's what motivates us sometimes, right? That it is because, excuse me, we're upset. And I know for myself, I'm getting sick more often because of the undercurrent. So please take care of yourselves physically, emotionally, psychologically. Find your emotionally, psychologically, and physically safe spaces. We need that. We need each other. And some of the greatest things come from how we are rooted in that rasa logia, or the logic of the people, of us, of each other. And so please lean into that and lean into us in any way, shape, or form. I also want to share that this work is, I'll share the I don't want to call it canned, but the purpose. But in this work, we bring our whole self so authentically. We're passionate about the things that we're advocating for. And in that, whether that's personally for the work, the organization, for the community, but also for ourselves, as we're thinking about these things, if there's anything that's activating you in any way, shape, or form, please lean on us, on those that you know. If there's something that you need to take a moment, please do that. These materials will be available. First and foremost, we need to take care of each other. And sometimes as we think about these things, we can get triggered. And so what that really means is take care of you, and we will help support take care of you in any way that we can. So I just want to ground us in that as we go into this. And so one of the purposes is very much to equip prevention professionals, to empower, to educate. And then how is that applied? I'm so grateful that this deck is really a advancement or expansion of the last, but it's a lot about conversation and application. And so we are so excited to share this space, to hear from you, and for this to be a conversation. So there's going to be a lot of moments where we ask questions, survey, Mentimeter, things like that, because we really want to hear from you. We're all learning from each other. So excited to share this space and really break open what it looks like to engage in policy advocacy and ethically and effectively, not only for ourselves, but how we hold others accountable in this space too, to maintain their ethics and never to compromise our integrity for anything, any system, any organization, any policy, what have you. But how do we do that and frame it effectively and ethically? So, and then as we move into the learning objectives, Jennifer, I would love for you to share what we were talking about, root causes and upstream.
Thank you, Nicole. Hi, everyone. Good morning. And I just also want to echo the words of Nicole and Tina, in that I hope that you are making space for bringing your whole self here, whatever that looks like in this moment in time. And if you have to show up differently or move a little bit differently now and at any time during the near future, I hope that you're honoring the time to do that. And just know that I see you and I feel honored to even be here with you and invited into this space. My name is Jennifer Khalif. I use she, her pronouns, and I just wanted to acknowledge that I do work and live on Tongva land in Southern California, and just really appreciate being able to be here because it is very rare to be in a room of preventionists. I am a preventionist through and through. I would consider myself a public health social worker, but I've been doing prevention work as named for over 15 years. And that is where my heart is. And that is where I feel like real change happens. So as we dive into the learning objectives, one of the things I thought would be really cool. So for any of you who are currently working on a piece of whether it's legislation, policy, and that could be big or little p policy, if there's a systems change thing that you are currently working on, if there's something happening at even like think the city level or your district level, you're really wanting to either move the needle on or advocate for, or if it's already in the works and you're a part of it, I would like for you to hold that and bring that into here and maybe use that as we walk through some examples and ask some questions. I also want to acknowledge that my Wi-Fi and technology has decided it is also done for the time being, and it has been glitchy. So therefore, I may go off camera just to kind of preserve bandwidth as well, and to maybe help so that way my audio doesn't get impacted. But I just wanted to name that before going off camera, and then you all thinking that I just left you, because that would never be my intention. As we go throughout the presentation, here are some of the learning objectives that we identified, but I also want to name that you may find something else in this space that you feel really resonates or deeply enlightens you in some way. And please hold that as something that you've been able to take away from here. But some of the things that we have identified have been really being able to walk away from the space, understanding the role of a preventionist as it relates to ethical and effective policy advocacy, being able to understand how you can show up and contribute your voice as a preventionist in this space and in the policy advocacy space. Understanding the differences between what is advocacy versus actual lobbying when it comes to policy change. Understanding the need for an advocate for policies and supporting mental health, substance use prevention, and social equity. Understanding why that matters. Understanding why storytelling is essentially at the center of that. And then lastly, being able to apply strategies so that you can effectively build coalitions, engage policymakers, develop relationships, find avenues for your clients and your communities that you serve for them to be engaged, and being able to apply action steps in your own personal policy efforts. So just a little bit of grounding in what we're hoping that you take away from this space and being with us this morning.
Thank you so much, Jennifer. And thank you all for all of the information that you are sharing with us in the chat. I too want to acknowledge, and I've seen in the chat in regards to land acknowledgement of where we are at, even though this is a blanket slide, because there are presentations that are done nationally. I too am on Tongan land and would like to honor my ancestors of the Dene Navajo community in Acoma, of the Acoma Pueblo in New Mexico. And so thank you. I appreciate that in the chat as well. We have shared a lot of information in the chat so far, but we would love to hear even more about what is one word to describe the person that when you think of them and why you advocate for them and why. If you would like to come off mute, or if you would like to add that and just expand on that a little bit, that would be wonderful. But we will continue to touch base throughout the presentation to keep bringing and honoring that person and bringing the group or community to the forefront. In the last workshop that we did and training that we did, we were talking about the differences between advocacy versus lobbying, and that advocacy is about raising awareness, coalition building, and education, also about equipping and empowering. And, especially for those that have been disempowered, to have that education and equipping to ensure that that agency is returned, that they are once again empowered, and to support increasing those protective factors, right, when it comes to voice and choice, and ensuring that you also understand the pathways and spaces and places that advocacy can be utilized. And so in lobbying, where it is slightly different, is that direct influence or call to action. And there's two different types of lobbying. There's direct lobbying, where you're going straight to legislators in regards to influencing or wanting to educate, but also have a call to action of voting yes or no on something, or expanding on the of what should be included in a bill and the impact that has. And then there's grassroots lobbying, and as nonprofits that we can do. However, we have to be mindful once we have a call to action. So we can reach out to our legislators. We can provide information about legislation and bills and things that are going to impact different policies. And when there's that call to action, it switches into a different category of lobbying. And as 501c3s and we have to understand that there are limitations. We can lobby, but there are limitations. And so in the previous presentation, we gave some examples of some different requirements that we have based off of the IRS determinations. So it's really great just to kind of understand where our outreach falls. And there are also some great if-then kind of flow charts that we can utilize as well, that will say, okay, if you're doing this, then it's this. And if you're doing that, then it's that. And because of the requirements that we have based off of IRS determinations, we just want to know what lane we're falling in. But the one thing that we really broke open is that a lot of it can be done in framing. There's policy advocacy, because that's still within legislation, right? Where a lot of folks will shy away from that. It's all about framing. It is about how are we ensuring that we are educating and not calling something to action, right? So writing letters, making phone calls, things like that. But we can stay on this side of it by saying educating in the sense of, but if this bill doesn't pass, this is the impact that it will have. If it does pass, this is what the impact that will have. And so it's all about framing that and how we're approaching it. And so lobbying is a strategy of advocacy. So it's, there is kind of a Venn diagram where some stuff kind of falls in the middle, and we want to be very mindful of that gray area, but we want to encourage and to make aware that we can lobby in both spaces. So it's just how it's done. So And then to really break open what these key legal and ethical distinctions are, because we want to continue to understand it truly is a conversation about nothing about us without us. And how are we ensuring that we're identifying the mechanisms and the pathways to ensure that the right voices are at the table, that the storytelling is happening, that the experience, true lived experience is happening, that all of the information that is being shared, being put forth is truly understood, including data, and how it's understood in a humanized fashion, that we know what does that actually look like? What does 1 in 5 actually mean to our communities, right? So, and how we can also reframe it. 35% of youth are consuming alcohol, but there's 65% of youth who aren't. So how are we then highlighting also the strengths and assets of the community already? And how are we engaging in that way and telling that story too?
When we think about advocacy versus lobbying, it really is around storytelling and informing and what you do day to day as a preventionist anyway. When you're looking at your primary prevention strategies, being able to advocate for legislation or for policy that is going to not cause harm, but help a community is really centering, as you've named, Nicole. And so not to say that over again, but really centering lived experience, really centering the voices who are traditionally don't have space or a seat at the table, or for folks who traditionally live at the margins, for really honoring those voices and those stories and centering impact. And so, as you named, you definitely you can advocate for a piece of legislation. And essentially, technically, you can also lobby for it. But if you're going to do something that would be considered actual lobbying, there's just a little more that goes into it as far as like your record keeping, et cetera. But as the advocate and as the preventionist, it is fully appropriate for you to say, this piece of legislation, like AB 123, if it were to pass, our folks who are facing homelessness and housing insecurity and economic insecurity and instability are going to be more deeply impacted by blah, blah, blah. So you can always educate and inform. You are allowed to name the legislation as you are educating and informing. The only where it leans into lobbying is when you say vote yes on AB 123. And so as preventionists, it's just naming the story and the impact which I'm pretty sure is what you covered, Nicole, but all I would have added in that space.
Please. Yes. No, I love it. Yes. Thank you. The Mentimeter is up and it is amazing. I love all of the things that you are sharing: justice, voice, empowerment, support, compassion, speaking up for others. In the chat, we have standing up and speaking up, thrive, giving youth a voice, speaking social justice, protection, education, defending, educating, responsibility, empowering communities, responsibility, demonstrating solidarity. Yes, I absolutely love that. I recently have been resharing quite often. I'm not sure how many of you all are familiar with The Bug's Life, the Disney Pixar movie, but in there, the grasshopper comes out and says, like, if the ants knew, one of the other grasshoppers is like, well, it's only one ant, and the main grasshopper is like, well, what if all of them do? And he like unleashes all of these seeds. What if these are the ants? And it's about our solidarity. It's about our unity and how we come together. And there truly is power in the masses. And so, that comes with being able to support each other on many different levels. So I, truly appreciate all that you guys are sharing, and you're in the thick of it. You are the gems and diamonds in the community that's taking back a block at a time, and you are truly creating pathways and learning opportunities on how we ensure that all voice and choices are respected and heard. So thank you. We were going to talk about the roles of prevention specialists and policy change. One of the things that I did want to mention in this space, especially as we begin to explore civic engagement and things like that is also understanding the policies of the folks that we work for, right? So we can define what advocacy and lobbying is, but also really understanding what your organization policy is. So I served at the Arizona Governor's Office of Youth, Faith, and Family as a substance abuse manager for the last 6 years. And we had very strict guidelines, even about our own personal outreach. And so just knowing what it is that, we had to adhere to, sticking to, and all forward-facing stuff professionally and personally had to be in alignment with the priorities and initiatives of the administration in office at the time. So it's just kind of really understanding your role and what that means, and not to ever allow yourselves to feel silenced. But then it's, how are we reframing, or are there alternative ways to be able to be just as effective while maintaining an ethical position with those that you're working with, right? And also holding others to that standard as well. Just a few of the roles of prevention professionals in policy change are those that are using their expertise to inform decision makers. We have an opportunity to submit information, research, technical assistance to legislators and to other key decision makers. It's promoting evidence-based policies while also centering community at the heart of it. Like Jennifer mentioned, that lived experience should be at the forefront and at the core of creating solutions, engaging our communities in systemic change, right? We're going back to that real upstream prevention. We're going to talk about the things, right? We're going to talk about the things that were developed within a system. And I like how Jennifer had mentioned that we're not demonizing a system, but we're just saying within it, as we know it so deeply and have a gain an understanding of that, of how we can work within it. It's not the position of the funding of this workshop, but I always say I went to the governor's office to dismantle the system from the inside. So the more you learn it, you learn the machine, the more you know how to use it, no more you know your space and you know where change can be enacted and advocated and lobbied for. And then it is also those within this space, even as prevention professionals, is using advocacy tools effectively. And so what that can mean is that we never want our message to get lost in the delivery, right? So when we understand the tools, the pathways, the policies, the procedures, the process, the more effective we can be in delivering our message without having the system or the process or what have you shut us down, right? An example is I facilitated the Intimate Partner Violence Coalition in Arizona at the governor's level. And we had a group of individuals that were advocating for youth that were going missing in Arizona's Department of Child Safety, and holding them accountable because many of these folks were showing up in online, OnlyFans, all of the things. And they came out very strong, and it was a wonderful message and advocating. However, it was, unfortunately, the message got lost in the delivery because of the space that it was in, the yelling, the screaming, a lot of different things, where unfortunately then they were excluded and banned to coming to these meetings. And it was so unfortunate that it just wasn't heard. There wasn't that trauma-informed space to be able to everybody to calm down. There was an immediate reaction. So there's professionals in our spaces that we can work together with that can help us to ensure that our message doesn't get lost in our delivery and understanding time and place, right? And next slide, please. Oh, and Jennifer, did you want to share about the training that you all offer?
Yeah, so at the coalition, we have what's called Building Change Together, our prevention core competencies training. And this is for preventionists who are new to their role or ones who have been in it for a very, very long time. But throughout this training, we really help orient prevention folks to understanding root causes on a deeper level and on that community level, and really examining things like, the failures of our systemic responses, institutional responses that are problematic or causing harm for our communities. And it's really built around the sociological model, but how is it that we can elevate our protective factors and reduce risk factors at every level by addressing our systemic issues, including things like, racism, sexism, homophobia, transphobia. So we really, really take a deep dive into understanding, what does power and privilege look like at all levels, and how is it that we are shifting the power back to our communities and to our individuals at every level, especially those who are most impacted. And how is it that we center their voices as we do that? And anytime we're talking about systems change work or those outer levels of the sociological model, we really want to root ourselves in understanding social justice and why that is at the core of all of the work that we do as prevention folks. And so there is the first level of the training is more like foundational. And then once you complete that, you can take level 2, which just dives a lot more deeper into these issues and helping us really unpack them and develop strategies as prevention folks. So I always invite folks to attend that space. The first time I went, I felt like, as I mentioned, it's very rare to be with a group of prevention individuals. Sometimes you feel very alone. And for a lot of organizations, we may have like one prevention staff for some folks. So being able to be in a room and in a cohort of my peers felt incredible, especially for folks who are doing similar work to me. And, just really understanding how important this work is and how important preventionists are and how that should really be prioritized when it comes to sustainability and funding for this work, because a lot of times we see that shift over to our intervention services. But what I like to say is there's no way for you to do intervention without prevention, because that's secondary and tertiary. But when we're really thinking about our primary prevention and how is it we meet our communities where they are, those strategies and being able to understand why we need to shift power back is so crucial. So if anyone's ever interested in that, you're more than welcome to reach out to me, and I'm happy to pass along more information.
So we're at another space to have conversation. There's another Mentimeter that we have up about what policy issue in your community would you like to impact? And so Jennifer had mentioned this at the beginning and would love to hear from you all to keep that in mind. And so we wanted to take pause and bring that to the forefront of what are some of the things that what policy or what are you advocating for?
Here at Positive Images, we have a lot of trans, undocumented. There's like an intersectionality of LGBTQ, trans, non-binary, and undocumentation. So the advocates, especially that are young folks that, may not have parents or family around, or that might be in the system. So we have like a whole list of resources that we trust and we know that we can refer them to. So we always advocate for good connections with the resources first, so we know it's a safe space, because I just don't want to refer anyone to just a space because they do legal work. Because unfortunately, we have run into a lot of legal spaces that are transphobic and homophobic. So that really doesn't help. So our team has to take the chance and actually meet with the people before we even send anybody to those spaces. So the advocacy also looks like being the first person kind of to check out the space before we send anybody into those, especially legal spaces. We have a lot of trans folks who can't do their passport right now because everything that's happening, and not only passport and documentation and like the whole world, because we only see sometimes the issues as separated rather than there's also intersectionalities between the issues, because it's not just trans issues, it's not just this, it's like the intersectionality of all. And so I'm here representing that and hopefully advocating for better safe spaces, especially for legal support.
Absolutely. No, thank you. Thank you so much for sharing. That's absolutely right. It's compounded. Right. It's compounded challenges based off of the intersectionality of that. And I absolutely love that you guys go out and advocate to ensure that these spaces are safe. And I cannot say it enough, is that we have to know our partners. It isn't just about partnership. It isn't about hearing them say all of the good things, right? Of course, and I'm not, no shade. I'm just saying the proof is in the pudding. Go and meet them, see the things, have them show, the spaces and places and all of the things. And it's even to the extent of knowing who their partners are. Because who are they collaborating with? What is their reputation within our communities? I was in Arizona for 17 years and working in that space with families. There's one particular organization that they always would get so upset when the case manager wouldn't assign. And I was like, why? What is going on early on, right? But in doing that due diligence, understanding the reputation that that organization had in the community was so much more harmful. But if we didn't advocate for them to get placed in another agency that was safer, then it was less likely that they would have positive outcomes within their case. And so I thank you so much for sharing that. And it is so vital to know our partners, and because it's a whole pathway for whole person care. And that doesn't just mean in your sector or the people that you already know, is getting to know everybody else who's going to touch the life of that person, right? So appreciate you. I will read some of them. This is amazing. Youth deserve resources, school to prison pipeline. Yes. Mental health on campus, schools, homelessness amongst youth, surveillance of, is it juvenile incarcerated youth? Is that what that is? I would love to.
Yeah, justice
involvement. Okay, perfect. Thank you. Policing, abolish us, them thinking, mental health on campus, transgender youth rights, prevention for substance. It's moving around. So I hope you guys can all read those, but that is incredible. It's amazing. And in these spaces and places, how important it is and wonderful that you guys are centering your experiences and those that you're serving. So thank you. And we'll come back around again. So keep these in mind. And, if it is a policy issue that or one that you would like to get involved in and don't quite know how, please, we'll make time and space for that as well to be able to have those discussions.
So as we're thinking about ethical considerations in policy and advocacy, I just want to highlight, I really appreciated what you all lifted up, especially the youth empowerment. I think that's really at the center. And when I go over some of these ethical considerations, I think that is a place where a lot of those lie. And so I want to I'll talk through these in a little bit, but what I would love to do is just give some really tangible examples. And so some of the key consideration for professional folks when it comes to policy advocacy, and our own ethical considerations, even some of our own, I would say some of these may arise as moral dilemmas, especially as you are trying to move something in one direction and maybe some of your either partners or organizationally it might not land. But as preventionists, as advocates, it's really important that we're really lifting these things and just kind of having an eye on them. And I know this has been named a couple of times, but one of them is really centering the communities who have been impacted and lived experience, making sure that whether you're drafting language or talking points, that you are inviting those folks to be a part of that process. So an example, we have the California Healthy Youth Act, which in our education code requires that comprehensive sex education and teen dating violence prevention education, sexual violence prevention education, and human trafficking be taught once in high school and once in middle school. Well, we just completed an audit of that. And what we found are there are a lot of school districts who are not necessarily complying with that piece of legislation. And so now that we have that data, we ourselves have assembled a youth advisory board to help us as we really start to think through some other policy strategies to make sure that these policies are happening on our high school campuses, but it's really coming from their lens and their lived experience and what they're experiencing now. Because if you even think about dating in a sense, I'm going to give one example. for a lot of us, depending on the generation that we come from, those definitions of dating have shifted dramatically. So we have a lot of young people who are exhibiting dating behaviors in their relationships, and even including things like sexual activity. But they may not have like a traditional label as being in a partnership, but they're still experiencing harm. They're still experiencing relational harm. They're still experiencing teen dating violence, but maybe under a different label. And like, that's one of the things that was flagged from our youth and coming from their perspective and their voice. And it's important in that framing because the impact is going to be the same, even though it might look a little bit different. Another thing is avoiding harm and unintended consequences. So really looking at our policies and strategies, looking at what might be on the scene that might continue to cause harm for communities. Some of those things might be, a policy around surveillance, let's say. That's a really good example. A few years ago, we had one for license plates. And I don't remember all of the details. All I remember is that it would have increased surveillance on our survivors and just lend itself to creating some additional barriers and challenges. And as preventionists, being really aware of what those things look like. So avoiding harm, unintended consequences. Also, responsible use of data is another core piece of this. A few years back, there was talk about maybe having some of our programs and organizations to segregate data into the AAPI community. And one of the pieces of feedback was, why? And is there going to be funding to help us have representation at the organizational level to be able to properly and appropriately serve those communities? And if that's not the case, why are we doing things like that? Again, power, privilege, representation are really core in our ethical considerations. Also, transparency and accountability. So really being able to name the why we are wanting to advocate for a piece of legislation or policy. Also being able to name the impact. And then anytime we are working with folks with lived experience, whether that, be survivors or communities who are being impacted by something at that systemic level, is making sure that there is dignity in their storytelling, making sure that they are consenting to using their voice, making sure that you are there to safety plan with them throughout that, and making sure that they know they have the ability and the control over what they share and don't share. Because a lot of times, sometimes unintentionally, it can kind of go over into that like exploitive space where we're using their lived experience and they're having to share something that impacted or traumatized them for someone else's gain. And we want to make sure that we are not doing that as preventionists and advocates. Another piece, when we're thinking about the spaces that we're in around policy advocacy, a lot of time that in and of itself can be challenging. I'm thinking about SB 54 here in the state of California. When we became a sanctuary state, I found myself in the offices of legislators on both sides. And a lot of times as preventionists and advocates, we really need to come in and figure out how to balance nonpartisanship with our own morality, but also being able to provide moral clarity in those instances. And I just remember when I was with, more conservative legislators who were like, well, I'm going to play devil's advocate in this minute, really being able just to stay true to my center and to my core and speak the facts of the harm, speak the facts of the why, and making sure that I was really holding on to that and taking care of yourself as well, because this can be very hard, especially when we are being human-centered and community-centered and we understand the importance of these issues. A lot of times you may be speaking with someone who might not be aligned. And so really just trying to make space for that. And of course, as we've named, cultural responsiveness, inclusion, and equity, just really, really being at the center. And those are some of, anytime you're contributing in those spaces, some of the ethical pieces. And, I think some examples, I've named a few, but just thinking about, let's think. I was thinking of a couple of examples. So I shared, data is a big one. Pressure on survivors is another huge one. I mentioned supporting policies that increase surveillance is another big one, or policies that increase criminalization. That's another one to always think about. Some other examples could be, speaking on behalf of communities without having any level of meaningful involvement with those communities. But aside from that, also shared decision-making with those communities. is another example of something that should be a part of that process. Another one kind of just to watch out for is aligning any advocacy position primarily with funding that moves you away from your like really core prevention values. That's something that I've seen happen in the past as well. And that is challenging, especially in a moment like this, where there's so much financial insecurity. There's shifts at the administrative level. When it comes to funding priorities, we're seeing threats and we are seeing programs deeply impacted by funding cuts. So I would almost say, but in that policy space, just kind of being mindful around shifting our own priorities to be able to acquire those funds. I would say that's like an organizational decision, but that's a very hard one and something just to think about and to have like in your lens if you are someone who's in a role where you might be asked to do some of those things. The other thing I'm going to name that I've seen is prioritizing those short-term policy wins over long-term impacts. And so a good example of this would be the prevention funding that we were able to get in the state of California for our domestic violence programs we had prevention dollars that were given. Every year we had been asking for ongoing funds, and these just came as like short-term bouts of funding. Now, all of you know that when you are building a prevention program in your community, that takes a ton of trust building and rapport building. And when those funds disappear and your prevention program just disappears, you're pulling the rug out from underneath not only you, but that entire community. And so for you to be able to come in and rebuild, that in and of itself is causing additional harm. So I would almost say when we're thinking longer term as preventionists and impact, and we know that, you know, as opposed to intervention, we don't have those like short-term deliverables that sometimes they want to see. It's really being able to frame the longer-term impacts and why those investments are so deeply important. And then lastly, I think the thing that I'll name is really ending our advocacy once that bill passes, because here's what happens a lot of times. A bill may pass, and unless you're someone who like is an attorney or who works in our space, you might not be aware of that. And so really taking a look at who is it that needs to know this information. A good example of that would be the coerced debt bill that was just passed, I think last year, which says if you are a victim survivor of IPV, and you can demonstrate that, then any debt that was acquired due to your relationship or the harmful partner does not impact your credit. But again, unless you're someone who like works in that space, how would you know that? So as the advocate and the preventionist, that would be setting up meetings with local law offices, speaking with other organizations that help with economic supports and really informing them around the new policy. So on the back end of the passage of these policies, there is a role for preventionists.
Yeah, and I just wanted to mention too, I mean, I loved how you said it was such a great segue of being able to know that it isn't just about lobbying or advocating for something to get passed, but it is also the next step of implementation and ensuring that that's being done ethically and effectively and just being done, right? So we do have just thinking about building that into your planning when you're doing the advocacy. The other thing that I wanted to share that to expand on what you were talking about, Jennifer, was about ensuring that we're keeping in mind, even though we are, when we're centering, as we should, the voice and the community and highlighting the lived experience and building solutions in that way, you want to ensure that we're not tokenizing the individuals, right? That especially in a time that we are that, you know, funding is a concern and there's a lot of stop work orders and things being harmed, that as we're getting out there, we want to ensure that we're protecting the people that we're working with. And like you had mentioned, Jennifer, that safety is so important. And we want to ensure that we're creating emotional, psychologically, and physical safe spaces for those that are sharing their experiences to move this advocacy effort and education along. And we want to ensure that others also aren't just putting them at the forefront to be looky-loos at, and that we're really honoring that space and place. So there's a lot of different ways that there's a lot of different types of ethical considerations to take into consideration in this space. And we would love to hear about how some of those things show up for you. We had a great example in our planning session when we were talking about how, okay, so a policy is passed, but how the organization then implements that policy. But sometimes that can be, those two things can contradict each other, right? Because you have this new policy that was implemented, but then in some way it can harm the individual that is the client that is experiencing the services. I'm not doing this justice. Jennifer, can you expand on that a little bit, just so that we can really bring that example home?
Yeah. So an ethical dilemma this continues to exist, but I'm thinking back to when I was in graduate school, we had to highlight an ethical dilemma. And this is something that I feel we all may bump up against. But if you think about housing and housing requirements, that sometimes, like, there are protections out there for undocumented survivors of crime, including gender-based violence. And let's say they move into transitional housing or something that's a subsidized housing, where although they may be protected, they've now filed for protections under VAWA or U visa, but there's this requirement to be able to demonstrate work. Well, if they have not yet filed their paperwork, even though they qualify, them being required to work and demonstrate that, or them working under the table, let's say, would then automatically disqualify them for those protections. And so, again, a consideration to think about when you are supporting your clients is looking at some of those things. So if you are to move them into a situation where, yes, they should be afforded protection, but if they do go this route, which they should be able to do, how is that setting them up for failure? And again, those are some of those systemic gaps that we see around moral and ethical pieces, because ethically, I think they technically shouldn't be required to demonstrate that until they are legally able to. So yeah, thank you, Nicole, for reminding me.
Yeah, thank you. No, I really appreciate that. And we would really welcome to hear, learn exactly unintended consequences, so these things in theory sometimes can look great, but it is about that next step of when we see it in implementation, and how are we identifying, but also advocating to continue to ensure that implementation is being done ethically and effectively. So we're going to talk about building effective coalitions. Dare I say, and after a segue from the last about ethical considerations of really centering those with lived experience and ensuring that we are building with and for them, and not with them and not just for them. As I would switch these two, the first for me is really engaging community members in advocacy efforts. But very first and primarily is, are we listening and learning from our community about what's most important? Our data, our things, the research, all of the stuff can point to a particular thing, or even if we're from the community, sometimes that's still our perspective. And like Jennifer said, it's about respecting the perspective of the individuals. And so as we're laying that foundation, normalizing that it takes time to build that rapport, and truly communicating and coming transparently and authentically of why we're there and how we really do want to listen and learn, and then identifying what those policies or what the focus or what is most important, and things that want to be changed, improved, increased, decreased, what have you. And then it's learning all about that, and then collaborating with the stakeholders in that space. And of course, as many coalitions are built with 12 different sectors and things, I want to be very intentional about that. And what do those relationships really mean with the community members themselves? Generally there's a law enforcement representation. Well, what is the relationship with law enforcement for that community? And what mechanism do we have in place to be comfortable with uncomfortable conversations, to know that when we're in this space, not everybody's going to like us or agree with us. I mean, that's just real, but how are we still having effective conversation? what's the mechanism when we don't agree, or when there's harm and violence that's been connected, when historically something has been broken. But we can still develop ways to bring everybody to the table. But it really is always about centering emotional, psychological, and physical safety, even when we're building our coalitions. And we want to bring people to the table that aren't already preaching to the choir, right? Like, it is about, okay, so we want to reduce consumption, let's say, of vaping or alcohol. But oftentimes the owner of the liquor stores and the vaping organizations aren't included at the table. Because even though we have different potentially ways that we are going, or even the goal might be different, but we can still learn from each other, educating that person. They can be educating us on what we see, and we can still work together. So then when we're all coming to the table and talking about it, then we're really leveraging existing networks for impact, but also creating new connections and partnerships with any space and place that's going to touch the lives of the people experiencing the very policy that we're advocating for. So it is expanding it, slowing down, taking a breath, and knowing that we're developing even more, just not what we're familiar with or comfortable with. There's a lot more folks that need all of the prevention activities that we're advocating for implementing. And then there are agencies, even when there's a lot of people, nothing is too saturated. We want to make those relationships, because what if it's not a good fit? But then for the person or the people, and then we have relationships with people that do the same services or expand on that. And we can be like, we're going to call Susie over at ABC organization, because I really think that is that's going to be a great fit. I would love to introduce you, right? So it's just being very intentional when we're building effective coalitions. And also to normalize, it takes time. And so laying that foundation and laying that groundwork, and the solutions and those spaces are going to come from how we're listening to our community members and equipping them. So Jennifer, would you like to add anything?
No, I think, I think you captured that really, really well. I think it's, what you said, just to reinforce the importance of really just making sure that we're examining in our collaborative work, like who has a seat at the table, who needs to have a seat at the table, who's missing, whose voice is missing. I'm gonna add.
Wonderful. Yes, absolutely. And this is perfect. So next slide, Tina, please. Because we want to be able to really examine like what organizations or groups are vital to collaborate with, those that we are really ensuring that we want to, it is nothing about us without us. If we're talking about youth, are the youth at the table? With all of the, like what Laura said about the compounded things, is there if we're talking about this, are these folks with compounded experiences, intersectionality that they're experiencing, are they at the table? And it's just inviting you to think about those that you wouldn't automatically think could be or should be at the table, but they do contribute. So what are some of the organizations that you all feel that are really vital to these conversations?
I think you should always be looking at which culturally specific organizations are not at the table as opposed to your mainstream. A lot of time, mainstream organizations automatically have a seat. And this is collaborations at all levels. So if you look, for us here in California, there's a number of committees that operate out of the governor's office. There's committees around domestic violence, sexual violence, human trafficking, and really taking a look, who are the elected folks who have a seat at some of those tables? When you have like your own county-based or community-based task force, who gets the invitation, who doesn't, who's not well known. But a lot of time, I would say, looking to your community and figuring out what organizations are there, especially the smaller, and again, the non-mainstream orgs are the ones that I would intentionally invite to have a seat at the table. The ones who are, working with communities who are traditionally underfunded, under-resourced, who are experiencing the greatest impact of systemic harm. Like those are the folks I would be inviting.
Yes, I love it. Yes, thank you so much. And I don't want to say it wrong, but is it Tamara or Tamara?
Camera, yes.
Tamara, thank you. Well, thank you so much for sharing what you did on the chat. Would you be open to sharing with us?
Sure. Yeah. So I think the vital collaborations are with organizations that understand healing, leadership, and that advocacy is essential, but not simultaneous, right? So we partner with groups who honor youth autonomy, share accountability, and are willing to slow down when ethics demand it. So I just think that this list is a starting point. It's not an end point. It's a starting point.
Yes, wonderful. Thank you so much. And those who can, please take down and look at the list and recommendations that she has put in there. And Cesar, thank you. CAYCJ, when looking for support, guidance, and knowledge on youth justice involved work at the state level. Thank you so much. Absolutely.
I wanted to add one quick thing to what Tamara said that was really important is, it's not that, like, let's say you have partners or collaboration and you're working on something together, to really continuously be examining, like, as things bubble up, like, oh, well, here's this one thing who's missing. But you use that. It's like, it's not exhaustive. That can always be expanding. It can also be decreasing. But I think you just lifted something very, very important in that, Tamara. It's not finite. And to always, be thinking about who else,
Yes, absolutely. Yes, it's a living, breathing relationship, right? And having those points, like you're saying, and I love that, of like a pause to be able to evaluate and be like, okay, where are we going from here? What's working? What's not working? And that's not, no shade to anybody that's involved, but just, do we need to pivot? Did we go adrift? And how do we get back to center? But absolutely addressing the things in the moment versus letting them snowball. And then next thing you know, and then unfortunately, that's when things can fizzle out or get abandoned or aren't followed through. And all of that trust that you have built goes away, like Jennifer had mentioned, and 100%. Because, one thing that I have been mentioning more lately is, especially related to mental health, when we're talking about our communities, we're talking about also trauma, right? And one of the mechanisms that come from that is hypervigilance. We are watching. Do your words and your actions align? So really thinking not only of the experiences or of particular things, but also what some of the coping strategies that we have developed as survivors. And so in some of that, we are going to be evaluated much, much differently and looked through a different lens, because there's been a potentially perpetuation of harm in other situations. And so that's where the transparency and authenticity comes, and how we're showing up, and they're watching, and if there is, and we're human, and making space. If we've stepped on toes or offended in some way, shape, or form, please create safe space so that you can also be held accountable, and that we're adjusting and we're still learning, and we want them to also know that we will take that responsibility and we will, we'll adapt. So I just wanted to share that, because it's important. Sometimes we forget about that, or we have an expectation that survivorship means resilience. And sometimes that's not always the case. Sometimes we're moving along so quickly and thriving sometimes because of what we're doing, masking in a lot of situations, imposter syndrome for some of us, I know for myself. And, so let's just be mindful we're human in human spaces, and that we can be held accountable for that.
So strategies for engaging policymakers. This is a really great topic of conversation. And I would say there's multiple strategies. I'm going to share the ones I have used and that we traditionally used. But I also think this is a great point too for anyone who's engaged any other strategies. So please feel free to share in this space. So sometimes there may be a piece of legislation that we are interested in or something that we feel we need as a community. One of the things and the strategies we've used is really taking a look at who are your elected officials who may hold power, and then figuring out, one, either where they're aligned, and two, if it's state level, what committees do they sit on? So for example, if it's something around like deflating carceral responses, I would take a look at who's on my public safety committee, and those would be the folks I'd be reaching out to try to build a relationship with. If I don't already have a relationship, I would be looking at the folks who may be centered. If it's like, let's say, school systems and support for youth on campus, or social emotional well-being or learning, I would take a look at who sits on anything that has to do with like school-based work, or those who were like former educators. But it's really like doing your research around who may have an interest. And once you can identify that, I would, if you already don't hold a relationship, figuring out who does. And that's where partnerships are really critical. Because even though you may not have a relationship like with an assembly member or a senator, let's say, one of your partners may. And so I would always be examining and exploring, how is it I can build a relationship? I know for us, when there's been a piece of legislation, we always do a strategy session to kind of pre-identify, all right, who are the legislators that we'd like to approach with this? Sometimes we're just doing cold calls where we're, sending them an email, getting on the phone, trying to reach out to their staffers. Their staffers are typically very responsive, but usually that might be the first place you're going to start, or asking for an introduction. Like I said, a lot of policymakers, legislators, elected officials at all levels may host community events or town halls. I've seen that happen when there's been, like, let's say, for example, Assemblymember Joan Sawyer in LA, there was a grant that was going to go out to CBOs, and we wanted to approach him around a piece of legislation that had to do more centered around like juvenile justice. And so we attended that. We attended the full town hall around this funding that really, it wasn't funding we were going to be applying for, but we just wanted the chance to get to connect, see who was in the room, and see if there was any alignment there. So, what we also would do is when we had downtime in our prevention work, we did a ton of school-based prevention work. And so sometimes during the summer months, or when we knew it was slower, we would intentionally set meetings with our local policymakers. And so just to get to know them. And so we would be in their offices anytime we had downtime throughout the year. We would set up meetings. We would share more about the work that we were doing. We would hear more about what their policy and their priority issue areas were going to be for the upcoming year. We would ask them, what is it that your constituents are saying? Years ago, Assemblymember, I think it was Harper out of Huntington. This was years ago when he was in office. So, for example, we would do those meetings during the summer, and that's where I learned that there had been a constituent who was saying that there needed to be a piece of legislation around, like, let's say someone had been arrested for DV. There was a gap in the release time between someone getting into like shelter or safe housing. And so the request was made to really examine if a piece of legislation was even needed around safety. And so, because that constituent had come to him and he had already met us, he called us right away and was like, hey, can I talk through this with you? And so those relationships and using some of your time to build around you also can be extremely helpful. Sometimes it's already kind of pre-developing your talking points and identifying, your data. If you have, let's say, for example, as I mentioned, we work with youth, and we have the California Healthy Youth Act. This year, we probably will have a prevention ask. And we will pull from our youth and ask who would be interested in being with spaces with us and help. They will co-create with us talking points, data points, and sometimes we will send that to the legislator ahead of time so that they already are kind of prepared for some of our goals and objectives and being able to build relationships with them. I'm trying to think of what else. I mean, I've touched on everything that's highlighted in the slide. But anytime, again, when you're thinking of engaging policymakers, it's going to be relationship building first and foremost, finding out who has an interest area where. And so strategically, you should always be approaching a policymaker or someone who's in a position of power based on alignment, because that's where you're going to get the biggest amount of buy-in. And then the next step would be really working on your talking points and getting something in front of them that's tangible and leaning on and leveraging the expertise of those with lived experience to help you in that.
Yeah, and I just wanted to, as you guys are thinking and thinking about what you would like to add, I just wanted to expand and share that, oftentimes, and even I did, I mean, because I was, what do they call, a non-traditional student. I didn't go back to get my degrees until much later. There were circumstances in life, and life was lifing. And so when I did, so not understanding or even feeling sometimes that I'm supposed to be in this space, right? Like those are those people. And, so what was really helpful for me, and a strategy that I utilized with youth when I'm bringing them into these spaces and places, is exposure, right? We don't go right to the meeting, but we went to the Capitol and we walked around, or you can have a tour and you can go into the Senate is open, the House of Representatives in Arizona. The House of Representatives is not, but you can walk through the Senate. You can go in, you can look at the things, and you can listen to different committee meetings, and you can see, just to start to normalize, to desensitize yourself to, there's a lot of history there. We don't, communities have different feelings, and we pass along different things within our own families, within our own communities. And so it's always been really helpful to just like desensitize, have a little bit of that exposure therapy in a way. And also to normalize the fact that even though we don't always speak the same lingo as the space that we're entering into, that we can communicate what we need to communicate based off of how we're aligning with them in our own language, or understanding or taking the time. It's okay. I mean, even for me, when I first went back to school, the dictionary was my best friend. It still is, or Google's at our fingertips. I do not know what that phrase means. I don't know what it is, but we have a lot of information at our fingertips, and it's okay. We don't feel like we have to know all of the things before we get there. We belong there, and voices need to be heard. And we can example that for those that we are supporting in entering this space that sometimes we don't feel like we're supposed to be at. So just that. All righty. Does anybody want to share kind of different strategies that you have worked for or when engaging in decision makers? Or, I know a lot of you all have leadership groups and things like that. How do you normalize some of this, or strategies that you use when you're engaging decision makers, or when you're bringing folks into that space?
Good morning, everybody. My name is Peter Elias. I'm with Green Event Self-Acting Coalition. What strategies worked for me when engaging decision makers? I noticed that for me, I like to give lived experience whenever talking to them. So instead of if I'm gonna go in there and tell them like, hey, advocate for something, I'm gonna tell them why I'm advocating and why is it important to me. So I'm gonna give them a little bit of my story, give them a little bit of my background, and then tie it into why my background fits with whatever it is that I'm advocating for or trying to talk to them about. And I noticed that usually works very well, because when you bring the personal aspect into it, it tends to draw them in more to listening and actually trying to understand it better. Because when you give them an actual scenario, an actual situation surrounding whatever topic it is, they'll be able to physically sit there and like kind of visualize it. If you say it correctly, they'll be able to sit there and visualize it and be like, huh, you know what? You're right. That's right. Like, crazy.
Right. Right. I love it. Yes, absolutely. Thank you. Yeah. And some people are so far removed, even if they have been through it, they're 4, 5, 6, 7 steps away, and they don't know what it is right now. So it's that twofold. So I really appreciate that. Thank you. Thank you for sharing. Laura, and then Caesar.
I'll let Caesar go. I've talked too much.
Caesar.
Hey, first and foremost, peace, everybody. I think it's important to put into context that we have a long, unfortunate experience of foundations being exclusive. And I think that the only thing that saves like people like Peter, like myself, is that we have community. We are grassroots. We are from the community. And so every time we go to these spaces, they have to accept us because we are the ones that they talk about. But I think one of the challenges is the narrative. Who's really controlling the narrative? Because you can go and meet with politicians and they're going to be like, yes, thank you for coming. But they already have their people that they go to, their kitchen table or their kitchen cabinet, folks. And I think that is something that I think we need to be better at strategizing. And how do we force, in a good way, right, in a positive way, because we don't want to burn bridges either, but how do we approach foundations to create better engagement opportunities that allow for more inclusion? So I think a big part of it, for me, I think I mentioned this a little bit at the last training that we had, was the importance of inclusion and also controlling more of the narratives of how funding comes into our communities, because a lot of times are those organizations that are funded are the ones that are advocating, and many times their lens are not really entrenched with the majority of community. They have a small percentage of community, and because they have proper funding, they can promote and make themselves look like they're doing something really big, but all they're doing is just giving out, the cheese to community to come to their events and activities, and that's what gets promoted. That's what's shown in pictures and everything else. So I think a big important piece is for us, who are more on the grassroots lens, to be better at holding accountable those, not just the leaders of those organizations, but holding accountable the funders and how they're approaching funding into our communities to be more inclusive. And so I think is really in regards of who do we bring and how do we collaborate. I think we need to have more of our community folk leaders that are not CBOs or are not in nonprofit organizations, but are from the block. And we know that if I bring my man G Wayne to the meeting, y'all gonna have to listen to what we gotta say. And so I think it's an approach of going back to the old school ways of being grassroots and changing the dynamic of how funding happens, where you have an organization that's dealing with 5 different issues, getting the funding to do that, where their focus is all over the place. And I don't think that's a strategy that has worked. And I think we need to learn from, with all respect, from the mistakes that the in California Endowment, for example, has done in the last 10 years, in regards of their ways and practices of engagement. And I hope that, with all respect to the Sierra Health Foundation, they don't follow that same suit in regards of how they're approaching funding, because I think that's been very detrimental, and it has stopped a lot of grassroots movements in communities because of the way the nonprofit industrial complex is structured in their approach of funding.
Ooh, yes. Thank you. What organization are you with?
So we're a mental health agency based out of Fresno. We're Integral Community Solutions Institute, and we work with, I specifically work with system impacted youth at the JJC, and then also through referrals from probation and the public defender's office.
Yeah, thank you. Thank you for sharing that. And yes, all around, we are uniquely qualified to be in the spaces and places. So I truly appreciate you. Thank you very much.
If there's any questions or comments that folks would like to share before we wrap?
I'm in Sonoma County, where, as an agency, I'm part of the Sonoma County Coalition Sanctuary here. And what's been hard is like hearing news, like the sheriff is working with ICE and like all this stuff. And it's like the people are supposed to be safe, right? And like you were saying, like how's the policy relationship, like the police and all that stuff, relationship with the community. And like Cesar was saying, sometimes like the focus on like where the money goes, what people are at the table, like everybody's on the table. And that's why, like, when I tell the stories, I don't like to tokenize them, because there's a lot of stories that, yes, funding, yes, quotes, yes, and everything. And there's always yes, and we got to be careful how we use those stories, because sometimes, as a Latina myself, Latina queer woman, it's really hard to like tokenize, like, oh, we're in a very, lots of white spaces, and that's really hard. And so I think sometimes using the pobrecito vibe doesn't work. And that's just not good. So One of the books that has been helping a lot is called Barras Bonita by Kim Guerra. Highly recommend that book. It's just the LGBTQ, like the queerness of like the pobrecito and pobrecite it's not cute. We just want to exist just like everybody else. And I feel like there's a lot of white savior happening, which is not cute either.
Absolutely. Absolutely. Again, goes back to why are you here? Are you being transparent about it? Yeah. And just because you put me through your car wash doesn't mean I'm going to come out on the other end the way you want. So my success, for definition of success, may not be yours. Thank you. Any other comments, questions? Thank you all. This has been phenomenal.
Appreciate everyone and your participation again, allowing me to be a part of the space. And I'm more than happy to answer any questions as well or follow up if there's anything I can do to support you.
Yes, absolutely. And there are a few that I hope that I will definitely be reaching out to as well. I love your positions, your strategies, your philosophies, everything. So I just want to thank you for allowing us, and it is an honor to hold this space with you all today. So thank you. Be good to yourselves and let's be here for each other. We need each other. So thank you.
Thank you, Nicole. Thank you, Jennifer, for sharing your insights and your stories and real life examples and bringing this to life. Thank you all for sticking around a little bit longer and giving us your time, sharing your voice here in the space and with each other. Continue to keep in contact with us. We have more offerings, like I said, throughout the year. Your feedback helps to guide this. So please, please, please share with us your thoughts as well. You have the QR code there as well as in the chat. But we all wish you grace in moving through today, in the next days ahead, weeks ahead. And again, thank you for joining us in this community. Take care, everyone. Have a wonderful day.
Thank you. Bye. Take care, everybody.